Do you know about the dangers and risks involved with oral sex? Some patients are unaware or even believe that oral sex is not related to sexual intercourse. Watch this video with me until the end, and I'll explain all the diseases you may be exposed to by engaging in this practice. For those who don't know us, we are the Dr. Men's Health Urology channel, where we provide tips and care for better male health. And now let's move on to the video. Many patients, when asked by doctors about the frequency of their sexual activity or sexual relations, do not consider oral sex as being related to exposure. However, this is a misconception, and the practice of oral sex can indeed pose risks and dangers, often unknown to those who engage in it. Before we delve into the subject and identify the 5 main diseases that may be associated with the practice of oral sex, let's clarify that the oral cavity, mouth, and oropharynx are environments with a diverse bacterial flora. In other words, there are bacteria that colonize our oral cavity normally, associated with the digestive process and our digestive system. Under normal conditions, they do not overproliferate. They maintain a usual number. However, in pathological situations, when diseases occur, these bacteria can overproliferate, and even the appearance of new pathogens that are not usual in the oral cavity can occur, such as the herpes virus or HPV. These pathogens are indeed associated with the onset of diseases. Furthermore, we need to remember that the urethra, which is the urine canal connecting the bladder and transporting urine to the external environment, is a sterile environment, meaning it is free of bacteria and other germs or fungi, and it can indeed be contaminated with this practice. But let's go ahead and identify the 5 main diseases that may be associated with this practice of fellatio. First, HPV, the human papillomavirus. As we know, there are more than 200 subtypes of HPV, some of which are related to the onset of oropharyngeal cancer and penile cancer, as well as cervical cancer in women. Additionally, these viruses may also be associated with the development of benign lesions, such as genital warts. Any HPV lesion in the oral cavity may go unnoticed and indeed pose an increased risk for a patient engaged in unprotected oral sex. It can indeed be a risk factor for the onset of ulcers or even malignant diseases like penile cancer. The second disease is oral candidiasis, commonly known as thrush. Oral moniliasis is a disease caused by a fungal infection, which can often be transmitted from the oral cavity, contaminating the glands, prepuce, and urethra, leading to a condition called balanitis or balanopostitis. These fungal infections are characterized by local discomfort, redness, flaking, and burning in the penis region, and their treatment requires antifungal, corticosteroids, or even some topical antibiotics. The third disease is herpes, and here we have 2 types of herpes viruses that have tropism, a preference for the lip mucosa and genital mucosa: herpes simplex virus type 1 and herpes simplex virus type 2. Under normal conditions, these viruses do not colonize the oral cavity. However, a patient with a lip herpes lesion can transmit it to another patient, causing a genital lesion through oral sex. The fourth disease, fortunately, is rarer, and it is syphilis. Syphilis is a bacterial disease that is rarely transmitted through oral sex. However, it can happen. The syphilis ulcer is quite characteristic, forming a single painless ulcer on the glands or foreskin, with raised edges and a firm base, which we can typically diagnose at a glance. It needs to be treated because it is a highly contagious disease. The fifth disease is urethritis. Urethritis is inflammation in the urethra, characterized by redness, discomfort, and urethral discharge. Under normal conditions, as I mentioned, the urethra is sterile. It does not contain bacteria. The 2 main germs that can lead to the development of urethritis are chlamydia and gonococcus. However, they will need a vector for transmission, and they can indeed be associated with unprotected oral sex. But what are the ways to reduce these risks? Folks, the main ways to reduce exposure to the risks of oral sex are by reducing promiscuity, decreasing the number of partners, and getting to know your partner, preferably always practicing with the use of condoms if this is not possible. Just like you wouldn't typically share a toothbrush with a stranger, some people consider certain practices common, but they should indeed be done responsibly and safely, such as oral sex. As a matter of curiosity, comment below if you were aware of such exposure, with dangers that were associated with this practice, or if this was new to you. If you found the content of this video important, if you think it will help someone you know, then share this information. Don't forget to subscribe, leave a like on the video, and activate the channel notifications to stay updated on our weekly content. A hug, and see you later.